Hello, Dr. Welligan again. As I mentioned to you just recently, last session, we were going to move on to part two in that subject that I think interests most of us, and that is obesity. I've mentioned to you before that we were going to move on to an interesting subject area of mine as a psychologist, and it is a interesting topic for psychiatrists as well. And it is the area which we we spend a good deal of time, and that is trying to understand the psychological factors that may contribute to obesity in any given individual. Okay? Why do people put on weight, maintain it, and are having a great deal of difficulty losing weight? There must be some unique psychological characteristics of the individual who really wants to carry somewhere around 50 to actually 300 pounds more weight than you should. So we spend a good deal of time here in this field trying to understand the psychological makeup of individuals who actually end up obese. By the way, since we're going to be discussing obesity in part two, the psychological characteristics of obese patients, before I do that, I'd like to draw your attention to my artistry here in the corner. We're actually looking at a very poor rendition of a human being here that I sketched a moment ago. This poor fellow here is actually standing with something attached to him. Can you see that rectangular item there? What you're actually looking at is an individual who is overweight and has strapped to his abdomen, across his shoulders, is a 25-pound cube of human fat. If you've ever seen adipose tissue fat, it's kind of yellowish in color, not really inviting, but nevertheless, we can cube it and attach it to an individual, as I have in my orientation programs and my discussion programs with obese patients at hospitals. And I'll ask that individual to walk around the auditorium with that strapped to his shoulders. You put 25 pounds on you, hanging out beyond your abdomen, and walk around for not very long, and you begin to realize, this thing is heavy. And some of my patients really can't get very far at all, 25, 50 yards, and they're beginning to feel it. So I ask them to complete it, given they have a heart that will support this, and come on back and sit down. Well, they do, and often they are out of breath and really feeling the weight. Get this thing off me, will you? And I am saying, that's 25 pounds of fat. Do you realize that you are carrying 4 of those around with you all the time? 4 blocks of fat hanging from your frame. No, I don't feel it. No, I can't be carrying 4 of those blocks. Kill me. I'd say you are, okay? And it's distributed throughout most of your body, okay? Well, why can't that individual feel the weight of 4 times more than that block? Yet at the same time, if I put a quarter of that weight on him, he notices it immediately and can feel the weight differential on his body. And almost universally, those patients who engage in this will come back and say, Man, is that heavy. Get it off me. Oh, that is the problem with obesity. Why don't people actually sense the weight that they're carrying and actually do something about it in a very deliberate fashion? Very often, the individual who's carrying this excessive weight only realizes that it is difficult because I'm running out of breath. I can't walk as far. And I use a cane to get around, but I continue to carry the weight. Okay? That's what we're going to be talking about here. We're going to move on to the psychological characteristics of individuals, patients who are obese. But I'd like you to file that. We're going to come back to that in the future. That's going to be a reference point for us, and a very important one. So don't fall asleep, okay? That's going to be on the test. So getting back to the classroom situation here, psychological factors contributing to obesity. You know, as I'm a research scientist in psychology, psychophysiologist, I published in that area, gastroenterology. We ask the question here, are there specific characteristics, variables, that can identify a particular behavioral pattern, or syndrome, if you will, or disease process, or any event out there in the world that we can actually say, if we do this, 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 and this, it actually produces that, a causal relationship. That is, psychological characteristics that are unique to patients with obesity. If we introduce those to the individual, he's going to become obese. And if you remove those psychological characteristics, remove those variables, he will lose weight. Okay. That's kind of like science, studying the causal effect between A and B. Well, we look for that in our area of investigation. And this has been going on for literally decades, okay? There have to be hundreds, if not thousands, of articles published every year dealing with the various correlated variables and possible causal variables, characteristics that contribute to obesity in America and around the world. I'm not going to review a huge number of studies for you. Gosh, they're out there. And I can give you some references there. PubMed is one there. You can even just go on the internet and Google the research dealing with obesity, and it'll print reams of stuff out for you. However, I'm going to cut to the chase and try to trim it down. One of the most important tests that we use as psychologists, that we pass on to psychiatrists, physicians, and attorneys who need this information, is a test that we administer to individuals who are required to complete that test, and that is the Minnesota Multiphasic Personality Inventory, MMPI. Been around since World War II. Very well respected, well known test that the results are generally accepted by members of a variety of professions that I've just described, okay? So if we administer that MMPI to patients who are suffering with obesity and compare their results or performance on that test to those who are not obese, who are, quote, normal, within their weight range, what do we find? Well, first of all, let me just tell you what the test actually attempts to identify. I'm going to write the scales that we look at as psychologists that actually reflect various personality traits, characteristics of the individual. The first scale is called hypochondriasis, HS for short. Hypochondriasis, a tendency here to have psychological problems that show up as medical problems, okay? Hypochondriasis, a tendency to, it's called somaticize. Somaticize, meaning your body. Somaticize your psychological problems. Yeah, we can do that. The other one is something I think perhaps we all know is depression. Okay? Enough said. The other one is HY, hysteria. I can't tell you a lot about that one, but mainly at the center is this tendency to sort of minimize or deny or kind of ignore that I have problems. Okay? Denial is a big one. A big characteristic of those who have a constellation of characteristics associated with hysteria. What is next? Hysteria, we have paranoia, psychasthenia, PT, paranoia, you know what paranoia is, okay? Tendency to actually be very defensive, concerned about what's happening to you from something occurring in the environment. Okay. Schizophrenia, mania, is social introversion. 1, 2, 3, 4, 5, 6, 7, 8. There's another one, and it's called the masculine-feminine scale, MF. And it is an index of the degree to which you actually incorporate we all do this, certain masculine characteristics and some characteristics that are more closely associated with women and their behavior, their personality characteristics. And that's what happens when you grow up in a family. You pick up a combination of traits, okay? Now, and you put these all together in the test. It's a long one, an hour and a half, and you take a look at everything, okay? And you try to determine, well, are obese patients scoring any more differently on these scales than, as I said, those of you who are within your normal range. So what we find is, in general, no difference between patients who are obese and those who are not. They all score within the same range, and they tend not to be statistically significant from one another as you study them as a group, okay? Ooh, no major psychiatric illnesses among obese patients as a trend. However, there are few studies that find this in some of their obese patients, okay? And that is a tendency toward depression. Also, a greater degree of anxiety. Also a tendency to complain about physical problems, okay? A little higher here. And because patients are obese, they tend to walk around and live with it. They have a tendency to actually minimize or put out of their mind for a while the fact that they are too heavy. So we get a little increase in what I call denial. A little more than perhaps those of us who are not that heavy, okay? So we get a cluster of these characteristics showing up in some of our obese patient populations. Now I want to mention something. Does that distinguish an obese patient from anybody else or from any normal person, or does it distinguish the individual from anybody else who has any other psychological problems? Are they any different than my chronically depressed patients, my acutely anxious patients, those who have a special, what I call neurotic tendency here? Not necessarily. Those characteristics I just described that you can see in some of these individuals are shared by others who have problems that have nothing to do with obesity. I have patients in my practice who have a lot of different problems, and they're not obese, and they can present with this same profile. In other words, we are looking for unique characteristics that we're not able to find in any clear, consistent fashion. Because what appears to be the case is that, in general, obese patients don't have any more psychological problems or psychiatric conditions than the general population. Okay? That's kind of where we're going if you take a look at the literature. Well, if they don't have some underlying psychiatric problem here, what is their problem? Well, a few of us have begun to ask that question. It's a question that I asked here a few years ago, and others have too. And if it's not that, does it have something to do with the way they cope with the world? Are there coping styles? Styles that they have developed to interact with the world and manage everything going on between them and the world any different than those who are not obese? Okay. Well, so let's take a look at coping styles. There we may have a way to go there. It seems to make more sense now. Okay? So I'm going to erase this and put something else on the board, okay? Don't take a break. Class isn't over yet. So we now move to another area of investigation. Coping. Styles. Coping styles. Real interesting. You'll see some efforts to understand that in the literature. What I did was I selected a very well-known test by a very well-respected psychologist by the name of Mellon, Mellon. And he has developed a behavioral health inventory. And in that inventory, he has a whole section on helping psychologists understand the coping styles of various people, various populations, okay? So let's say we take that Mellon and we administer it to a group of obese patients and those who are not obese, of course, and compare their coping styles, okay? Let me go through the coping styles that Mellon was interested in and I was interested in. Okay. The first coping style, some of this is self-evident, okay? I don't have to explain it in detail. Those who are introverted. Excuse my penmanship, it's terrible. Introversive coping style tends to be somewhat shy, withdrawn, socially somewhat uncomfortable, but really lives in the world of ideas, okay, for the most part. The other is inhibited, emotionally inhibited. And psychologically and behaviorally inhibited tends to be very restrictive in the expression of his own feelings and even behavioral patterns, okay? There's another one who you may know, and that's the cooperative individual. These are people who are really very eager to please others, okay? And really have a desire to try to be accepted, okay? So we're going to be very cooperative with you, get along with you, do what you want me to do, okay? Because I don't want to upset you, okay? Sociable. There is the extrovert, the individual who really kind of interacts with the world comfortably, apparently. Could be very dependable. And he wants to appear nice to everybody, okay? 5. Confident. Individual here who appears to be very self-confident, very self-contained, capable, has his own opinions, her own opinions, very strong, can go from one mood to another, can be very nice and then oppositional, sometimes resistive. You may see that aspect emerge, personality characteristics emerge in the confident individual, okay? Forceful. Forceful. Okay, domineering, tough-minded. Can be distrustful of others, relies on his own judgment, has a little difficulty following the advice and recommendations of others. What is 7? Respectful. Very conforming, cooperative. Your feelings are more important than mine. I want to always sort of give you the impression that you're very important. I'll hold off on expressing my side of things here. Real need to feel like they like me, okay? Number 8, sensitive. You probably know somebody like this. Feelings get hurt easily, very sensitive, very vulnerable. Can't take too much or else she cries. But on the other hand, we kind of respect her because she's very, very charming and delicate. Okay, sensitive. Those are the 8 coping scales. Okay. Well, let's take a look. Compare obese patients to those who are not, what might you expect? You know any overweight individuals? Remember, if you're scoring higher on this, you tend to be more, you're weighted more in the direction of these variables if you score high on them. Do you see any difference between the groups here? Introversive? No, not here. Not here. What about inhibited? No. Cooperative? No. No statistically significant difference. Sociable? No. Confident? No difference. Forceful? No difference. Respectful? No. No statistically significant difference between them. And sensitive? No. What? You mean obese patients actually look fairly normal with regard to these coping mechanisms and coping styles. There's no significant difference between them and those who are not obese. They look pretty normal. Where do we go? Okay. I'll be back with that, the answer to that question, and an expansion of this study that I conducted in just a moment.